The patient was managed appropriately. The patient is very young patient, and then not much of major medical problems. So if you have patient like this, even though prognosis is very poor, you want to do everything possible. So the initial presentation, regardless of whatever the presentation is, you want to make sure the patient get the intensive treatment, to control the disease. So if you look at the whole the natural history of myeloma, the myeloma is a disease which is an incurable disease, but having said that, there are a lot of new therapies, and there are a lot of different agents that have been developed in the last 2 decades, and that have made the myeloma a kind of very kind of chronic disease. There are some subsets of myeloma patients who have almost 10+ years survival, and which was not possible 2 decades ago. More importantly, the development of immune therapies, in particular chimeric antigen receptor T-cell therapies, bispecific antibodies therapy, and all those newer immune therapies have changed the paradigm, and it's going to change the outlook of the disease for majority of the patients in the future. But there are still some subset of patients, for example, like this patient, who has a very high-risk disease, and those are the patients who have whose prognosis is still very poor, with a median survival of less than 3 years, despite the best treatment options that you have. So in this case, what happened is the patient got the initial treatment, and then the patient got into remission, which is what you see in most of the patients, including the high-risk patients like this. And unfortunately, the patient probably have a disease relapse. So Rashmitha, I don't have a lot of data after that 9 months. You kind of provide the data on the how the patient presented with orbital lesions and the skin lesions, which is what is from the amyloidosis. But do you have any data on the myeloma labs or the myeloma presentation? Did the patient have any other features consistent with the relapse?
This patient, her presentation for the last 1 month, in the month of December ending in January, when she presented, it was, as you said, sir, it was the relapse of multiple myeloma, because she presented with features of AKI. She had features like shortness of breath, pedal edema, generalized swelling, anasarca. Probably this is because of amyloid light chain deposition in the kidney that led to nephrotic syndrome, as well as we thought it is amyloid light chain kidney disease, because the cutaneous lesions as well as the raccoon that is present is also attributed to the amyloidosis that she had. So we went ahead. Sorry.
Sorry to interrupt. So, this is a very unusual presentation of the amyloidosis as well. If you look at most of the amyloidosis present as primary